Hello, everyone. A very good evening to you all. Myself, Dr. Sumedha Gupta, and on behalf of Voice of Healthcare, I would like to welcome all the viewers who have joined us. So, today, we are here to present the sixth episode of Detect to Protect, a series of awareness session in fight against the breast cancer, organized by Voice of Healthcare and supported by Zydus Life. In today's session, we'll explore about the vital insights on breast cancer, from recognizing the signs and symptoms to the importance of early detection, prognostic testings, policy advocacy, and the latest treatment options. So let's come together to empower ourselves with the knowledge that protects women health. Before starting the discussion, I would like to share some facts about the breast cancer prevalence in India. Breast cancer in India possesses a significant public health challenge, accounting for about 14% of the global burden. The incidence is rising at 1.5 to 2% annually, with approximately 60% of cases diagnosed at advanced stages, which severely impacts the treatment outcomes. The average age of diagnosis is around 45 years, younger than the global average age of 61. And the survival rates varies widely from 70 to 80% in urban areas in comparison to 40 to 50% in the rural areas. Awareness of the symptoms is really low, with only 20 to 30% of people are informed about this disease, and less than 10% participate in the regular screenings. Cultural barriers and stigma further impede timely medical help, especially for the women with the family history of breast cancer who are 2-3 times higher risk than normal. These factors highlight the urgent need for improved awareness, education, and the healthcare access to address the rising burden of breast cancer in India. And in the light of these stats and facts, I would like to welcome Dr. Jatin Sarin, who is the Director, Medical Oncology, Livasa Hospital, Mohali. Welcome to the discussion, Doctor. Good evening.
Good evening, Ji, and Namaskar.
So let's begin. Welcome, Doctor. So let's begin with the discussion points. So, Dr. Sarin, if we talk about the early signs and symptoms of breast cancer, so can you please provide us with your information on, what are the most common and early signs and symptoms of breast cancer that women should be vigilant about?
See, the most common sign or symptom you can say that women approach us is the lump in the breast. So this is the commonest sign. The other important signs are bloody nipple discharge or puckering of skin of breast, puckering of nipple. There could be some lumps in the armpits also, which could be a sign of some cancer in the breast and spreading to armpits. So there could be a very subtle sign in the form of some redness or associated with a bit of itching also. This can also be a sign which is commonly considered to be an allergic thing. It sometimes presents with that, and sometimes you also have lumps in the neck also. So these are the various signs and symptoms by which the patient usually come to us.
Thank you, Dr. Jatin, for these insights on these signs and symptoms. What are the alarming signs that women should consider and should not ignore and really rush to the doctor about it? What are the most alarming stages, I would say, or the sign and symptoms, I would say?
See, I would say that every woman should not consider any change in their breast as casual. So there are no alarming things. I would say each and every sign and symptom should be alarming to them. So lump in breast, yes, it should not be ignored. It should be thoroughly examined, tested. With usually we do triple test in the form of ultrasound or fine needle aspiration, cytology, clinical examination. All these things we do, which when they come with the lump. So any sign, for that matter, which I have just mentioned, should not be taken casually. They should be taken as alarming and approached to the clinician. But again, I would say there should be an element of panic. The thing is that most of the time, 80% of time, these signs and symptoms could be due to some benign condition also. So I would urge the woman that be vigilant, but don't panic. That is my this thing, because uh, people these days are becoming very aware. Women are becoming very aware, and that is really good. That is really good. But there is sometimes an element of panic, and sometimes in that panic, females are hesitant to get themselves checked. So there should not be panic, and they should get themselves checked. Be relaxed. 80% of time it will be some benign cause like fibroadenoma, or all. There are various benign things. The even bloody nipple discharge is not always a breast cancer. It can be simply ductectasia or anything of that other conditions which can be easily managed. So but don't take anything casually. Get yourself checked.
Thank you, Dr. Jatin, for these insights. I would like to know your views onto the awareness about the symptoms. I mean, there are so many myths and misconceptions about the breast cancer, and how can the awareness of these symptoms can actually influence and can help in detection of the cancer and the treatment outcomes?
Well, these are the symptoms which we have just alluded to. I mean, the lump and nipple discharge, lumps at various places, armpits, and all. So, any change in a female's breast, which can easily be detected by self breast examination, which will allude to in further discussion. So any change in the breast, especially beyond the age of 35, 40 or so, should not be ignored, because if the female comes to the practitioner with any early sign, there are chances that we may be able to detect the malignancy in its very inception or a very early stage. So that early stage breast cancer is 4.4 times more likely to get cured compared to advanced breast cancer. So that is the importance of early detection. So awareness of the females or women is very essential.
Thank you, Dr. Jatin, for these valuable insights. Moving ahead with the discussion to the screening parts, can you please explain the different screening methods available for the breast cancer and how often women should undergo these screenings? And what is the right age to start it?
So for screening, what is screening? First of all, screening is a detection of the disease in very early stage, even if the disease is not clinically, or there are no signs and symptoms of the disease. And at that point of time, if you are able to detect the disease or catch the disease, then it has a very high cure rates, more than 90% cure rates. So there are various screening modalities in vogue since long, and breast has a very effective screening modalities in the form of mammogram, which is X-ray of breast tissue. These days, we are getting digital mammographies available, which are very very sensitive, and they can detect very very small lumps also. Then you have the most important and practical screening modality for our country, that is self breast examination, which should start as early as the age of 25 years. Mammogram for an average risk female should start from the age of 40 years, should be either yearly or 2 yearly at least. And the self breast examination is done monthly, and it should start right from the age of 25 years. For a high risk female, suppose there is a history of breast cancer in someone's family, and that breast cancer happened at, say, 40 years of age to the mother or Masi or anyone, then the females in those family should start screening at the age of at least 35 years. So, screening part is there are very good organized screening programs available in Western countries, and that is why their cure rates jump. Like we have cure rates where the best cure rates we achieve in the best of the centers is around 80%. That is not by virtue of any dearth of treatments or treatment modalities available. It is only by virtue of the stage of cancer we catch. So there they are able to detect the cancers by screening, and that can be effectively taken care of and leading to high cure rates.
Thank you, Dr. Jatin, for providing us with insights on the screening method. Since you mentioned about the self screening part as well, so can you please provide us with the guidance on the correct technique for conducted a breast self examination and what
Right.
mistakes oftenly people do and how we can correct that?
So, self breast examination, what I feel is the best modality for our country that every female should do, right? At every month on a fixed date. There should be a week gap between the menses and the examination. There should be a tall mirror in each and everyone's bathroom, I would say, in Indian household. Sometimes it is not available, but it should be there. So, a self breast examination involves inspecting first. It starts from inspection. First, the female stands in front of the mirror, inspects or observe the sizes of breast, each of the breast, the level of nipples, any change in either of the breast, any kind of skin changes, any kind of nipple changes. All those things are first visualized, and then gradually with
Yeah.
the with three fingers or with the palm, they should for the left breast one should examine with the right hand, and for the left breast sorry, for the right breast they should examine with the left arm, left hand. So they should palpate their breast in the standing position, and also they should
Okay.
palpate their underarms in the standing position. Later on, after that, the same thing, the palpation part should also occur by lying down position. She should lie down and examine the breast in lying down position also. So there are proper techniques available easily on the net. Females can easily access those things, and there are so many awareness groups which provide with these techniques also. But this is the basic thing. Two very important thing: inspect your breast carefully and palpate your breast carefully. Any change, if it is observed, go to your clinician, and if he feels that yes, this should be addressed by way of taking a sample or by way of getting a mammogram or a ultrasound breast done, that should be done.
Thank you, Dr. Jatin, for providing us with the self breast examination techniques. Moving ahead with the discussion to detection and the diagnostic parts, what are your views on to what diagnostic tools are commonly used to confirm a breast cancer diagnosis, and what tests are there once a suspicious finding is identified?
So the most important thing is when we do mammogram, we identify a suspicious lump. Any lump in mammogram, we have some gradings. Like if it is BIRAT 4 and above, there is high suspicion of breast cancer. So what we do is we confirm it with an FNAC, right? If it is very small, you do an ultrasound guided sampling. But FNAC is fine needle aspiration cytology. From with the help of a syringe, we take a bit of fluid and check it on a slide that whether cancerous cells are visible or not. Even if they are not visible and there is a high grade suspicion that yes, this might harbor a cancer, then one must always go for a core needle biopsy. This is very, very important. People tend to forego core needle biopsy, or females tend to avoid core needle biopsy with a misconception कि if इसको अगर छेड़ दिया तो ये फैल जाएगा, which is absolutely wrong.
Hmm.
It is not like that, and this is a very, very sad and uh, much prevalent misconception in our society. But
Yes.
the exact diagnosis comes with a biopsy, and it is done through needle only. We don't have to do any, we don't have to give any kind of a cut or anything. There is just
Hmm.
that it is slightly thicker needle as compared to a fine needle aspiration cytology. So the purpose of biopsy is twofold. One, for the exact confirmation of cancer. Second, to subtype the cancer,
Hmm.
which will guide us the kind of
Yeah.
treatment that we want to give for the particular type of cancer. So that is why biopsy is the backbone to give or to provide with the correct scientific evidence-based treatment to a female for the best results. After that comes staging. Staging can be done depending on the size of the lump. You can simply do a CT scan of chest, abdomen, or sometimes if the lumps are larger, we go for a PET CT scan to look after the lungs, any disease in the liver or any bony lesion, so that we are very clear that whether it is a localized disease, loco-regional disease, or it is a spread out disease. Because our treatment intent as well as our treatment modalities vary according to the type and the stage of the disease. So this is how we go ahead with the treatment part. Uh, yeah. Mm.
Thank you, Dr. Jatin, for providing us with the insights on the treatment methods and for busting the myths that biopsy should be done. Moving ahead with the discussion about the risk assessment and the genetic testing. So, in your view, what factors are considered in assessing an individual's risk for developing the breast cancer, and how significant is the family history in such cases?
Well, risk assessment is really very important. There are various lifestyle factors which add to the risk of breast cancer, and among them, obesity, dense breast, lack of physical activity. All these are alcohol intake, smoking, excess intake of hormone replacement therapy in postmenopausal female or perimenopausal female. So these are some lifestyle risks. Lack of breastfeeding to children, that is also an important lifestyle risk. The other important risk is one is family history. Family history is when
Hmm.
if your first degree relative is having breast cancer, then your risk of having breast cancer increases fivefold. So you are higher than average risk. And second is the genetic history. So genetic these
Yeah.
days, hereditary breast cancer is different from familial breast cancer. Hereditary is when you carry the genes which actually make you susceptible for a particular cancer from your ancestors, or there are genes present right from the
Yeah.
birth make you susceptible to breast cancer. So there are certain there are in different studies in India conducted. The two most common genes are BRCA1 and BRCA2, which are easily tested these
Hmm.
days. So about 20% of Indian family among different studies on the average have found out they carry these genes. So once there is a presence of these genes, then the lifetime risk of a female getting a breast cancer is around 50 to 80%, whether it is a BRCA1 gene or
Hmm.
BRCA2 gene. Lifetime risk of getting an ovarian cancer is around 40 to 50%, and in BRCA2 it is around
Hmm.
20 to 30%. So, so these genes can be tested. There are certain guidelines that which patient should be tested for these genes, and if they come positive, then we test the family members also for that particular mutation, and we can give them risk reduction advice and intensive risk reduction advice so that they don't get, or they don't face such a problem of breast or ovarian cancer in future. So this is the difference between a familial and a hereditary. Otherwise, for risk reduction, the best part is that each and every female should be encouraged for self breast examination.
Yes.
That is my sincere message to each and every female. Be aware, but along with that, the caveat is don't panic.
Thank you, Dr. Jatin, for these wonderful insights onto that. Moving ahead with the discussion to prognostic testings. So, what types of prognostic tests are currently available for the breast cancer, and how do they help in predicting the likely course of this disease?
So, first and foremost, prognostic test is when you do a biopsy, you test for various receptors for subtyping the breast cancer. Broadly, there are three subtypes of breast cancer. One is hormone driven breast cancer. Second is HER2 new receptor. There is a receptor which is present in around 25 to 30% of breast cancer, which makes it really aggressive. So that is one subtype. And the third subtype is triple negative breast cancer. So triple negative is when all these receptors
Hmm.
are absent on the testing. It is actually the worst subtype of breast cancer. In India, around 15 to 20% of cases are triple negative. So HER2 positive and triple negative breast cancer, which are not actually hormone driven, are a bit aggressive cancers. They tend to relapse even after complete treatment as compared to the hormone driven cancers. So, for hormone driven cancer, we treat it with surgery, chemotherapy, radiation, and followed by hormone tablets. We give them some tablets which keep the
Hmm.
uh, future relapse in check. Similarly, for HER2, there are now very important drugs in the form of antibodies, which are given after completion of all these treatment. The important difference between HER2 positive, negative, and hormone driven cancer is that for HER2 positive and triple negative breast cancer, even in early stage, one should not go for surgery first. They have to be given systemic treatment. Systemic means some chemical treatment in the form of chemotherapy, so that
Yeah.
we are able to control the disease systemically and then go for surgery. So that will give us the best results as compared to going for a surgery first and then going for a systemic treatment, right? So again, this
Yeah.
was one type of prognosis. The second type of prognosis is, suppose there are among the subtypes of, there are various hormone driven. There are very very slow growing tumors, which if detected in early stage, sometimes they don't need chemotherapy after surgery. So to find out
Hmm.
that, there are specific tests available which can be done, and we can forego chemotherapy and treat them only with hormones. So that is
Yeah.
these prognostic tests are all also available. Uh, and as I said, the genetic test, hormone driven breast cancer and triple negative
Hmm.
breast cancer, they should be tested for at least BRCA1 and BRCA2 gene. Ideally there should be a broad panel testing which is available these days easily, so that we are able to find out that are they harboring such mutations. Because if it is present, then we can counsel them about the risk of getting an opposite breast cancer also. Even we can counsel them and do a risk reduction measure for an
Hmm.
ovarian cancer also. Plus, in triple negative and
Okay.
hormone positive breast cancer, there are some tablets available which can be given after completion of chemotherapy, surgery, radiation for 1 year, which can reduce their risk of relapse. So it has therapeutic implications also.
Okay. Thank you, Dr. Jatin, for providing us insights on the prognostic testing and the treatment part related to that. Moving ahead with the discussion towards the conclusion, I would like you to please provide us with any advice or recommendation you want to give out there to the patient who are newly diagnosed with the breast cancer or at the verge of this disease.
I just want to give this particular message that breast cancer is the commonest malignancy afflicting not only females. Among the females, if you see, the commonest malignancy is breast cancer, followed by cervical cancer, and so on. Even in both the sexes combined, the incidence of breast cancer is highest. But the maximum research has been done in breast cancer, and it is treatable and curable in most of the cases. So whosoever is diagnosed with breast cancer, they should follow the scientific treatment. First of all, don't hesitate for treatment. Go for a biopsy,
Hmm.
get themselves subtyped, get themselves staged, and go according to your clinician advice, which is the best way to eradicate. This is the keyword, is eradication. We have to eradicate the disease from the body. That is most important. So we have to cure this disease. So it will be very strange to hear, and the panic is mostly because of this thing only. People feel that cancer is not curable. Breast cancer is one of the most curable
Hmm.
thing, because of the available modalities, newer kind of surgery. Even now we are tailoring the treatment, both as far as chemotherapy, immunotherapy, or antibody therapy, and for that matter surgery and radiation also. We are de-escalating the treatment in certain cases, Like I said, we test some hormone positive cancer for some prognostic testing, and the ones who don't require chemotherapy, we don't give chemotherapy. So we are not only looking at the eradication
Yeah.
of disease, we are looking at the long-term quality of life of a particular patient, so that she can have a normal life, long survival, and a with a good quality of life survival. Even young females, there are some females, those who get breast cancer, sometimes they ask question ki, later on, if they want to bear the child, will they be able to do it? I tell them yes, it is very much possible. That won't increase their risk of breast cancer. No, it doesn't. So not only it is treatable, person can live after treatment with a good quality of life in a normal way.
Thank you, Dr. Jatin, for these valuable insights and your advice to the people out there who are suffering with this disease. In conclusion, our objective for today's discussion was to explore and emphasize the importance of breast cancer care by integrating insights on recognizing signs, symptoms, treatment parts, screening parts, etc. And I'm confident that our experts have addressed this crucial topic comprehensively and effectively by presenting the information in a very simpler way that a layman can also understand. I would like to extend my gratitude to Dr. Jatin for your insightful contribution and for sharing your expertise with us today. Your participation has been really valuable. I would like to thank you for joining us today and for contributing for this important conversation. Thank you so much.
Thank you. Thank you very much.
Thank you.